Okay, if you've ever tried to memorize the side effects for the main anti-tuberculosis drugs, you know it can feel just impossible. We're talking about four key medications that are absolutely crucial in fighting TB. But what if I told you there's a super simple trick to remember them all? Well, today we are unlocking the R.I.P mnemonic. You know that feeling, right? Whether you're a student or a healthcare pro, you're staring at this long list of drugs and their side effects, and it all just kind of blurs into one big, frustrating mess. It's a classic problem. But here's the good news. You can actually turn all that frustration into total confidence. There's a way to not just memorize this stuff, but to really get it so you can recall it effortlessly. And the secret? It's surprisingly simple. We're going to use something called a mnemonic. Now, if you're not familiar, a mnemonic is just a fancy word for a memory tool. It works by taking really complex information and linking it to a simple, memorable idea. Honestly, it's one of the best ways to learn something for the long haul. And this is where it gets really, really cool. The key to remembering the side effects for these four TB drugs is hiding in plain sight. It's right there in the very first letter of each drug's name. So let's break it down one by one. First up on our list is rifampicin. This is a cornerstone of TB treatment, and it's got a very unique side effect that its own name is going to help you remember forever. The connection here is just so simple, you'll love it. Just look at that first letter, R. R is for rifampicin, and R makes you think of red. That's because this drug can turn a patient's urine, and sometimes even their tears or sweat, a harmless reddish-orange color. See? R, red. It's simple, it's direct, and you're never going to forget it. All right, next up. Let's tackle the I in our mnemonic, which stands for isoniazid. Let's see how this pattern keeps going. So again, we're just going to focus on that first letter, I. What does I make you think of? How about ice? And what happens if you hold on to a piece of ice for too long? Your fingers start to go numb, right? Well, that feeling of numbness is the key. It points right to the side effect, peripheral neuritis, which is nerve damage that causes, you guessed it, numbness and weakness. So let's trace it. Isoniazid, I, ice, numbness, peripheral neuritis. Got it? Okay, we are halfway home. The third drug in our R.I.P mnemonic is pyrazinamide. Let's see what clue is hiding in this name. The first letter here is P, and the association is immediate. P is for pain. Why? Because pyrazinamide can raise uric acid levels in the body, which can sometimes lead to a really painful attack of gout. So just remember, pyrazinamide, P, pain, which points to gout. And now, for our final drug, ethambutol, let's lock in the last piece of this R.I.P puzzle. Take a look at that first letter, E. You know, this might just be the easiest one of them all. E for ethambutol stands for eye. And that directly points to its most important side effect, visual problems. We're talking about things like optic neuritis, which can mess with color vision. So E, eye. And that's it. So we've walked through each one piece by piece. We've seen how just a single letter can unlock the memory of a key side effect. Now let's put it all together on one screen to really make it stick. Just look at how perfectly this all comes together. Rifampicin, R is for red, urine. Isoniazid, I is for ice, which means numbness, or peripheral neuritis. Pyrazinamide, P is for pain from gout. And ethambutol, E is for eye problems. R.I.P. You now have this solid mental framework you can pull up anytime you need it. And that, right there, is the big takeaway. Look, medicine and pharmacology are incredibly complex, but you don't always need complex methods to master them. Sometimes the simplest, most elegant tool, like a really good mnemonic, is actually the most powerful one you've got. You just watched how a simple little word can unlock a pretty complex topic. So really, the only question left is, what difficult subject are you going to conquer next?